Haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Let's look into the flaps. So flaps are also known as the pedicel graft, and it consists of a partially or completely isolated tissue. So it's partially or completely isolated tissue as segments with their own blood supply. So it has a own blood supply. So absolute indication of flaps, what does it include? It includes the exposed bone. So there is exposed bone, exposed brain, radiated vessel, and the pressure sore at bony prominence, as well as open joint or the non-biological implant materials. Next is, what are the types of flaps? So there is a random flap. So random flap is not based on the name or on named blood vessel. It is a V and Y plasty. So this is used for the fingertips and extremities. Fingertips and also extremities. Then comes a Z plasty. Z plasty is for lengthening the tissue and also the post-burn contraction. So for lengthening the tissue, scars, and the post-burn contraction. It relies on the low pressure found in the subdermal plexus. Next, it is used to reconstruct small full thickness defects. So reconstruct the small full thickness defects. Next, moving on, we look at the axial flap. And this axial flap is based on the named vessel. So another important thing is the previously what we saw, that is the Z plasty. It is not amenable to the skin grafting. Now this axial flap is based on the named vessel. Now when the axial flap remains attached to its proximal blood supply, so proximal blood supply, see when the axial flap is attached to its proximal blood supply and is transposed to a defect, it is known as the pedicel flap. Next is the tram flap. The transabdominis muscle flap is the most commonly used flap for the breast reconstruction. So it is known as a tram. That is a transverse abdominis muscle flap. This is based on the epigastric vessels. So epigastric vessels, that is the superior epigastric vessel and the inferior epigastric vessel. Next we move on to the free flap. So here a free flap is nothing but an autogenous transplant. It is an autogenous transplant of the vascularized tissues. It is there is devascularization from donor side, devascularization from the donor side, and revascularization at the recipient. Revascularization at recipient bed. The tram flap is based on the inferior epigastric vessels and is usually free flap. Next is the DIEP flap. The DIEP flap is known as the deep inferior epigastric artery perforator flap. So this is the best flap for the breast reconstruction, and it is only the fat is taken from the flap. So fat is taken from the flap, and advantages is there is no muscle weakness. To learn and grow daily like this, please do subscribe.